مراكز علاج الطبية، رواد الصحة النوعية، أول شبكة طبية متخصصة تغطي خدماتها السعودية، الإمارات، مصر، قطر ولندن. علاج بلا حدود.
Urinary incontinence is very common. Indeed, about 10% of the world's population suffers from it at some stage or another. Most people, when they get old, will run into problems with it, just as newborn babies have a problem with continence until they're about 3 years old, or sometimes a little older than that, when they've learned how to control their urine. Once a child has developed urinary control, there isn't commonly problem, except in women after childbirth, or everybody once they get past the age of 50 or so. In women, the association with childbirth is very strong, and that causes a problem with the muscle, the sphincter as it's called, that's supposed to hold urine in the bladder. This gets commonly damaged during pregnancy and during childbirth, and weakness of this muscle is a common reason why women have problems holding their urine, particularly when they're active later on in life. In men, there is a common association with developing enlargement of the prostate, although it doesn't necessarily follow that continence problems are associated with the prostate, or indeed the prostate problems are associated with incontinence. In men, however, and in some women as well, the problem is not weakness of the bladder outflow, but overactivity of the bladder. An overactivity of the bladder, rather than causing weakness when active, coughing, laughing or sneezing, tends to give rise to a frequency of having to empty the bladder, having to get up at night to empty the bladder, and particularly urgency of having to go and empty the bladder, sometimes associated with incontinence if you can't get to the toilet on time. When weakness of the bladder outflow occurs in women, the most common form of treatment is surgical, to provide support to the bladder outflow so that it can work more effectively. In women or men who have incontinence due to bladder overactivity, giving frequency, urgency, getting up at night and urging continence, the treatment is different. Here we use drugs to damp down the bladder to make the urgency and frequency less. These drugs are drugs such as ditropan or detrusitol or Vesicare, and these work very well in damping down the bladder. In men who have an association with prostatic disease, then usually the prostate needs to be treated to allow the bladder to then be able to be treated to make it calm in the same sort of way. So generally, in women, there's a surgical approach to treatment when it's related to childbirth. In men with prostatic disease, the prostate needs to be dealt with so that the incontinence can then be dealt with. And in either men or women who have problems of frequency, urgency, all due to bladder overactivity, then medication may be necessary to bring the problem under control. Whatever the cause, it's common, it's easily treated, and usually with very satisfactory results.